We are going to speak today about case studies for customers of us, and during this process we are going to demonstrate our capabilities and technology, and I would like to hand it over to Camille now.
Thanks, Eyal, and thank you everyone for being here. Thanks, Aya and Amir, for all the organization. So our presentation today is going to focus on the key milestones for development to scale. So one of the questions when you start a project, or when you start a company, or when you start to develop a new product, you will ask yourself, where should I start? And so if I ask you the questions right now, most of you might respond planning or finance or thinking of moving forwards quickly because I need to be the first into the market. Well, all this is true, actually. But you need to think about all this and not just one of these items. Because if you do not think about all this, the little piece that you see in this puzzle, there, it's not going to fit at the end. And you will have to redo everything. And so that's why when you are an engineer or when you develop a new product, most of the case, you will face challenges when you reach the mass production phase, because you will need to rethink of your product. So the presentation is going to focus on key case studies and on the pitfall they have faced. So everything that I'm going to present is case studies that we have faced or that I have faced previously. So the first step is idea and concept. So you start dreaming about a lot of money, but before that you have a lot of work to do. And one of the work to do is to move forward with your idea and start to implement it. So one of the company, it was doing screening for a cancer, and the CEO is Aran, I know him very well, and he starts working on this company back in 2001. He has created the company in 2010. 10 years of research almost, only 3 hours per night, as we all know when we are CEO. And then he starts getting secured money, so almost 2 million and 25 people working for him. And then the investors say, okay, your idea is brilliant, but now you need to move forward. You need to go into the concept evaluation phase. So this is where it becomes challenging. Because his idea, he actually used what we call PDMS in microfluidics. So I don't know how aware are you of microfluidics? Almost, kind of. So microfluidics is when you use small devices, small microchips. So we have samples that we can show you afterwards if you're interested, to lower the number of reagents or how the number of liquids you're going to handle to screen, for example, diagnosis, the less use less blood, sorry. So he was doing screening, so he has made his first proof of concept into PDMS. PDMS is a soft rubber, very easy to use in the lab and very, very good for research. But when his investors say, okay, now move forward to prototyping, he actually couldn't move forwards into prototyping because the design he used for his PDMS wasn't moldable. So he had to redo everything. He has raised 2 million. He had to raise 2 more and get rid of 10%. And so it wasn't a good phases for him. So to avoid that, it's really to start to focus. The problem is not to use PDMS. The problem is actually to use PDMS to create your whole business plan of your company. You need to think that PDMS is not going to be mass producible, so you need to think forward. The evaluation phase. So now you have the idea, you have done your research in your lab, it's working. Now you need to do more evaluation. You need to prove that it's working on tens of samples. So for this, we had a company that was doing, it was an SME working for screening and diagnosis. And they were so they were actually trying to do a mix of reagents. So you imagine a round with different reagents coming in sequencing. And so they use PDMS, but PDMS is actually a soft rubber. So when they were doing evaluation, the soft rubber didn't close properly at each valve, and so nothing has worked. The investor backed out, and the company unfortunately had to close. So when you start thinking forward, you need to also start thinking of which material you should use from the beginning for the purpose you're looking at. In terms of, so we had the idea, we had the evaluation, and then we are now at the development and verification phase. So here you are talking about 100 of pieces. So you need to prove that it's working repeatedly, that it's feasible to go into mass production and everything. This one is based on a big player story. So the big player, they had wonderful idea, wonderful evaluation. Everything was working very well. They even spin out and create a new business unit. It was amazing. And then they were doing prototyping. They went straight to a manufacturer without rethinking their design. And actually, when they get the sample pieces from the manufacturer, it wasn't, so when you have microfluidics, you have the plastics, and then you want to cover your channels with what we call film bonding. So it's not going to leak, and your reagent is going to remain in the right channel. So this piece was actually slightly bent, and so the bond couldn't work. And so it was a complete mess. Everything was leaking out. And so they had to rethink how to, so the design was right, but actually the design wasn't good enough for prototyping. So they then, because it was a big player, they had the time and the money, so they went to a design house like Aran, for example. They asked them to redo and analyze the root cause. So they found that because it was leaking, because it was slightly bent, and then the design house went to Enplas for mass production. And finally, you reach the stage of mass production. You are here. You finally will have the millions that you were expecting at the first slides. You will finally be able to relax, kind of, and you need to find a good mass production. So this story is about a startup that was doing diagnostic for cancer therapy. And the CEO has worked a long time. The company is doing very well. They have now reached so they have their prototyping test that is working, excellent market feedback, amazing order, and they finally reached a stage where a big player, so a pharma industry, asked them for a partnership for a year. So you can imagine that it was a big relief for the company, a big party. I remember everyone, woo, that's it, we can now launch the company, definitely. So they went for mass production. And they used the same prototyping shop for their mass production. The problem is, this prototyping shop, because it was quite, fair enough. They know the company, they know the product, they know the design. Why would we bother change? But the real question they should have asked themselves is this company good enough for mass production? Are they able to supply what I'm expecting for? And the answer was unfortunately no, because a few weeks to 2-3 weeks after, the CEO got a call from the big player. They were pulled off the offer because 60% of their microfluidic device were leaking. So they are now looking for a second supplier, and we are working with them on that. So that's how you should think forward, and this is linked to the fact that everything needs to be integrated from the beginning. You can go fast, and you can use few steps in between, but you can use that if you know that you will have to change in the future, which means that you will need to look for someone else in the future. And this is what Enplas believes in. Enplas stands for Engineering Plastics, and we believe that we should be able to support a company from the beginning to the end, and for that we believe that we should be able to be everywhere, kind of, and most than that, we believe that we should be able to understand all the application you're working on. So we have worked from engineering plastic gear solution, developed our own IP, and then we went to audio cassette hub, and every time we improve ourselves to go into molding and injection molding high precision up to microfluidic biochip. So myself, I'm the commercial project manager. I'm based in the UK, in Cambridge, and Eyal, my colleague who's here, is the business development manager. He's based in Israel here. And now Eyal is going to present you a bit more of what we can do and our specification.
Okay, so I would like to demonstrate a few examples of microchanneling, injection molding, precision modules, and what can be achieved with these type of very accurate structures. So I don't want to go into details with each and every picture that is shown here, but what I would like to say is that there are different ways that you can manufacture or plan for scale. And the most important thing is to keep it as simple and as repeatable as possible, because then and only then you can plan to go to scale. So for example, if we're talking about microchanneling and very narrow channels, in injection molding technology, such as we show here, you can get your unit out of the injection molding equipment ready to use. There are no need for any other processes to go after. And yes, you can manufacture it in other ways, but then the number of steps are going to be more than one step, and then the more steps you have more room for failures. I also want to outline that Enplas, as an injection molding company, we are not just specialized in injecting plastics. We are, as written over here, a one-stop shop in a way that for the medical devices and for diagnostic market, we do have a lab in Cambridge. We are actually handling cells, and we are not just handling the plastics. We are handling the whole process from beginning till the end. So when we start from the very concept, and we can analyze from the very beginning till the very end all the stages, and look for all the places which the process could fail, and help the customer in order to avoid this ahead of time. So yeah, I would like to hand it over back to Camille and continue.
Yes, so as I mentioned when I started to talk about Enplas, the main thing for us is really to understand everything. Not everything, because it's not possible, but at least to understand the part that we are trying to focus on, which is life science. And therefore, they have created the lab in Cambridge 2 years ago, where we are doing experiments over cells. And there is also a lab in Japan, where they are developing and understanding the root cause of microfluidic devices. So if you have, for example, a problem of leakage or something like that, we can take your sample and analyze the samples there. So that's the conclusion. I talked about the different steps, idea to